Thank you.
Hi Claire, so I'm Tracy, one of the information and support workers here at Mummy Star, and one of the things that a lot of our mums will talk about, and you know, is something what is universally known now as scanxiety. So you know, you've got a scan coming up, it might be you know, looking towards finding out what diagnosis is, or you know, for further treatment, or just a routine scan. And you know, these can cause an awful lot of anxiety to build up. So really we're looking at, are there any suggestions that our mum, you know, for our mums to be able to try and I guess manage that anxiety, or try and alleviate?
Yeah, scanxiety is something that I come across quite often, and also anniversaries as well is a big one for anxiety. And I think that if you know that scan is coming up in a week's time or 2 weeks' time, I think is always to try and I always say to my clients, can you try and bring it back into the day? You know, it may be in 10 days' time, but you know, right here, right now, what are we doing? What is it that we're focusing on today? And I think that's really important, because we're not in 10 days. Although that anxiety is there, we're not in 10 days' time. We're in today, and we're into that moment. And I find that works really well with my clients, and they might say to me, but how do I do that? How do you get into the day? And I said, you know, sometimes it's just a case of bringing yourself right into the day, right into the moment, saying, what am I doing now? What am I doing now? I'm sitting down having a cup of coffee, eating a biscuit. I'm walking down the road pushing the pram. I'm about to wash the baby's clothes. You know, what exactly am I doing right here, right now? Because sometimes it takes you out of that projection of that anxiety, because we don't know what that's going to bring. And it's also about sharing your feelings with another person. You know, if you are part of Macmillan, share those feelings with Macmillan. Ask to see, maybe to see a professional. If you're really worried, has your nurse got time to speak to you? And also just being kind to yourself and really looking after yourself, and you know, maybe try and have a nice hot bath or a nice cake or something that you like doing, just to try and bring you into that moment. But it's really looking after yourself and just bringing yourself right back. And it might feel hard to do that, but it's just that, what am I doing right here, right now? And that can help to bring you back into the moment.
Just to, I suppose, add one of the other dimensions into this conversation, because obviously some of our families sadly will have lost a baby as a result of either directly because of the cancer diagnosis or for any other reason, sort of, you know, during pregnancy or postnatally. When you don't necessarily have that, I suppose, that distraction of you know, some of the examples you just gave of, you know, where you're trying to busy yourself doing something with baby or washing clothes or anything, you know, where you don't have that tangible distraction, if you like, where I suppose, you know, when we were talking about earlier on about the rumination could be to do with, you know, the cancer diagnosis or trying to arrest those feelings, but you've got two layers going on at the same time. Any sort of, I suppose, any insight in terms of when you don't have that distraction of, you know, of baby or that growing pregnancy?
Yeah, I am actually with counselling somebody at the moment that has you know, lost that child, and it's a really difficult time, and it's for that person to learn to come to terms and to try and accept the things that have happened, which is really difficult. And really, that's bereavement, and I use the 5 stages of grief method a lot in therapy, and it would be looking at those, you know, looking at those areas, and if it has sadly come to the loss of that child, I would most definitely suggest professional help.
Yeah. Okay. I think that will lead us well into the next piece. So thank you.